Bismillahirrahmanirrahim. My name is Dr Ashfaq Hussain. I am consultant psychiatrist here in Saidu Group of Teaching Hospital, Saidu Medical College, Swat, KPK, Pakistan. The Covid-19 infection may be stressful for people. Fear and anxiety can be overwhelming and can cause strong emotional reaction in adults and children. The psychological symptoms due to any infectious disease outbreak include fear for one's own health and the health of loved ones, changes in the pattern of sleep and eating, difficulty in falling asleep and concentration, worsening of chronic physical illness or mental health illness. Every individual reacts differently to stressful circumstances depending on so many variables, but the most vulnerable people are old age people and people with chronic physical illness who are at high risk of developing serious illness secondary to the COVID-19 infection, teens and children. Those people who are involved in the care of COVID-19 infection patients, like doctors, nurses, paramedics and other people in the chain of care. Similarly, people with chronic mental illness or those who are susceptible to mental illness and people with substance misuse are also at high risk of having strong emotional arousal secondary to this COVID-19 infection, and which may lead to the development of either new symptoms or the worsening of existing symptoms. There are certain ways we can effectively cope with the stress of the COVID-19 infection, like we can increase the duration of our ibadah. Similarly, we need to take a break from watching, listening or hearing news stories, including social media. Hearing about the news repeatedly can increase our stress and lead to frustration. We need to take good care of our body, like we need to take deep breaths, exercise regularly, stretch, meditate and do yoga. Try to eat healthy and well-balanced meal. Avoid smoking or using other substances. Try to do healthy activities that you enjoy. Similarly, talk with people you trust about your concerns and about the feelings that you are going through. Learn and share the facts about COVID-19 and help stop the spread of rumors. When you share accurate information about COVID-19, this will help people feel less stressed and make a connection with them and help stop the stigma. Call your mental health services when the stress gets in the way of your work for a number of days in a row. People with pre-existing mental health conditions should continue with their medication and therapies and beware of new or worsening of their existing symptoms. And importantly, ensure social distancing. Wear a mask when you are in public. Wash your hands repeatedly and kindly don't leave your home or workplaces unnecessarily. Thank you.